Okay, the axis is oblique, both medial-laterally and superior-inferiorly and aperiorly. So it crosses all of those three planes. So we're going to fantasize that we can actually measure motion around a single axis, but know that that's just a complete fabrication in our minds to try to make things easier. Okay? So in my attempt to be accurate, what you'll see is, if you can go to the next slide for me, please. So ankle pronation is made up of three different components. Dorsiflexion is one. So while it says ankle pronation, what we're actually measuring is dorsiflexion for this one, okay? We're measuring the dorsiflexion component of pronation to be the most accurate. But these slides might be confusing, so make sure you look for the word in bold to know that's the component we're measuring. Okay? It's a lot of squiggling with my back to you. Are you giving me bunny ears or something? Okay. So for ankle, plantar, and dorsiflexion, you have to have the knee bent if you're doing goniometry. And why might that be? Gastroc, right? If we measured ankle, plantar, and dorsiflexion with the knee straight, we've now lengthened the gastroc at the knee, and so then that might limit our ankle motions. So the only difference between measuring ankle dorsiflexion and a gastroc length test is the knee position. Okay? And that's a really common mistake that we see, that you're supposed to be measuring ankle dorsiflexion, but you're actually getting gastroc length. Okay? Now, the other one that is goofy about this one, that no matter what I say, people don't hear me. There's this big knob on the outside of our ankle called our lateral malleolus. It seems like you should stick the axis of the Goni on that big knob because it's just sitting there for you, right? Resist the urge. Okay? If you put it on the malleolus, you will not be able to bisect the fifth metatarsal, and you will get an incorrect measure. So when you're lining up the Goni, we're going to line up the stationary arm with the fibula. Okay? But the axis is actually going to be distal, because the two bones that we're trying to measure is going to be the fibula with the stationary arm, and then the fifth metatarsal with the moving arm. Okay? That requires the axis to be much lower than the lateral malleolus. But it's very hard to resist because you've got this big old circle sticking at you when you're nervous, okay? All right, so in this position, your starting position is going to be 90, and my guess is that Emma barely gets there. Relax your foot for me, let me take it. Okay, so that's the starting position for dorsiflexion. If you have someone who has plantar fasciitis, Katie, she may also have a hard time getting to that neutral position, okay, because we're already starting to stretch that plantar fascia. So for Enfield, okay. So she has zero dorsiflexion, and she's got a bony Enfield, right? Yeah, see, so this is what I hope you all have, is this natural curiosity. So I would love to see her do a squat and palpate and see what's going on here.
My foot comes up before I get all the way down.
Yeah. So, yeah. So like, she doesn't want to get in there and like mess with it. She's had surgery on this side, so we wouldn't want to mess with it too much. For the ankle plantar flexion, it's going to be the exact same way. So here I'm coming in and testing Enfield. And there I'm getting a good nice capsular Enfield for that one. Okay? The landmarks are going to be exactly the same. The starting position is that 90 degrees again. That's what we call zero. Now, if you have someone who can't get to zero, you'll pick it up in their gait because they'll have to pick their leg up sooner. Okay? And they might have more of a steppage gait on that side. But the ankle plantar flexion is one of those that you want to make sure they can get to zero because they may not be able to. Okay, so for a lot of times we don't have to measure that starting position. Ankle dorsiflexion is one you might have to, and plantar flexion. Okay, what do we have next? Does someone have their middle flexible or their small flexible Goni?
Yeah.
Yeah.
The tiny one, not the middle one?
Your middle one's still rigid, right? I need a flexible one.
Yeah.
You want to talk about subtalar neutral?
Subtalar neutral, so you're going to put your thumb and index finger on either side of the talus. Sorry, Michaela. Okay. Then I'm cupping the calcaneus. I'm keeping equal pressure on the skin, so I'm not pinching on the bone. I have equal pressure on the skin, and I'm trying to get the talus to be equally positioned between my two fingers. Okay, so for her, that's right here. So now I could measure dorsiflexion again while she's in this subtalar position. Okay, so then I would bring her up, maintaining her calcaneal position, and then taking that measurement as well. Okay? The key, you can imagine if this is my talus, and I'm on either side of the talus here, and I pinch on the talus, well, it's going to feel like I'm in subtalar neutral because I've grabbed either side of the bone. So what you want to do is grab the skin and have equal pressure, and then move that talus in between there until it's equally pressing on both fingers. Okay? But if I pinch hard enough through the skin to grab the talus, as I move the talus, my fingers are going to move with it, and it's going to feel equal already. Okay? This is something, we don't have an expectation that you will be perfect at finding subtalar neutral, but we want you to start practicing it. You'll get back to it next year. Okay?
So we do that before we do dorsi and plantar flexion measurements?
No.
Okay.
So there is a second measurement that you could do, and that would be dorsiflexion and subtalar neutral to see how much it impacts their range of motion. So it would be a separate line in your documentation. Okay? Good thing you said that because I looked at the board. What I had said in response to Leah's answer was that we were going to talk in class briefly about palpating piriformis. Her second question was, how can you palpate the piriformis when the way you know how to activate it is by resisting rotation when you're in sitting, and then the muscle isn't available to palpate, right? And so I had said, is there something else, a trick you know in prone that might work for activating the piriformis? Does anyone know what that might be?
Could you bend the knee?
Exactly. So you can resist hip rotation with the knee bent and resist that right in prone and then have your hand on the muscle. Okay. So I don't know, somehow I saw you, so I wrote that on the board, but then I forgot again until I looked at the board and there it was. Okay. All right. This next one. So if we move our foot, the bottom of our foot, the sole of our foot, towards the midline, that's going to be inversion. And if I move the bottom of the foot out, that's eversion. What I'm not doing is windshield wiping. Okay? It's moving the bottom of the foot inward or moving the inside of the foot outward. Okay? So we're going to measure those components. You need a goniometer that will bend this way for this one. Okay, so that's why we're going to use this goniometer. So the stationary arm is going to line up along the shaft of the tibia. The moving arm is going to line up with the second ray. The axis is going to be over that mortise. Okay? I'm going to hold this here, and if I were doing passive range of motion, go this way, which she has an overabundance of, but I thought she's got nada. She's got more than nada. so she's at about 22 that way, I'm surprised. Okay, so we're having so little dorsiflexion, look at that, you've got crazy amounts of inversion.
That's because I sprained them a lot.
Before
That's
you flexion it?
No, the fracture came first, actually.
You did.
Maybe.
Maybe. It was a long time ago. Okay, so that's ankle inversion and eversion. Okay? Oh, okay. Now you get to go on your stomach. And may I use one of your cool colored pens? Thank you. Now, go ahead and scoot back all the way here. When we talk about movement of the foot, does someone, Maddie, I'm gonna borrow your bottle. Although yours is pretty. I took it back. You can have that lame old one. I'm gonna take Katie's. We're gonna look right. So when we talk about movement of the foot, we talk about a couple of things. So we've got the movement of the forefoot, okay? So the tarsals on the metatarsals on the tarsals. We've got movement of the midfoot, which is the movement of the tarsals on the talus and calcaneus. And then we have movement of the rear foot. Okay? So, especially for those of you who are interested in orthopedics or have been a runner in the past, we really care about movement in all three of those, and we care in particular what happens in the stance phase of running at all three of those places. Because if you have limited motion here, your body's going to respond by excessive motion elsewhere. Okay? Particularly in the rear foot. If you've got wonky rear foot mechanics, it's going to have to be compensated up front, and if it's not, that's going to create its own list of problems. If you have an uncompensated forefoot, you're actually going to get some knee problems. Okay? So you need to be able to look at the foot motion-wise from that perspective. So here, we're going to be measuring so when we measured inversion and eversion just now, we were measuring all of those motions. Okay, so it's really a gross motion of everything when we measured from the anterior aspect. So sometimes you would even specify that by calling this supination and this pronation. Okay, whereas back here we're going to call it more inversion and eversion. Okay, now when I moved her foot, I was also moving her into inversion and eversion. Okay, but really the front one is measuring all three components. Okay, so now we're going to try to isolate inversion and eversion. So what you're going to do is it okay if I write on? So I'm going to grab her calcaneus and draw a line right down the middle. Bleep. Sound effects are free. You want to be careful. Some people are going to have a pump bump, it's called, and it's a callus, usually on the lateral aspect of the calcaneus. Typically, you're going to see this in runners who have less than completely efficient running patterns. You don't want that to skew you. You want to make sure you're grabbing the calcaneus when you draw that line. Then you need to ignore that line, and you're going to want to draw a line that represents the tibia. Now the trick here is that the lateral head of the gastroc is bigger than the medial head, and so you don't want to, you may have your line too far lateral if you try to bisect the calf. Okay? So when I'm drawing the line, I'm really looking at the knee and trying to ignore the shape of the gastroc. Okay? So I really want that to be in line with, in my mind, the view of the tibia. Now, don't draw this line way down here. Draw it up a bit on the leg, because then what you're going to, and make it long enough so that what I can do is line that up through my clear goniometer, and that way it's an easy check to know that it's in alignment. Right? And then the other one is the moving arm is going to also line up on that line that I've drawn on the bottom. Okay, so she's resting in, well, exactly, maybe not exactly. Yeah, pretty close. She's in 15 degrees of inversion. That's just her resting position. So the first thing I want to do is, can I get her straight? Now I'm using those lines that I've drawn to see if my goni is still straight. And I can get her straight. Okay?
That's the good ankle.
But oh, it is, okay. So see, even on this ankle though, I can get you to 5 degrees passively. Is
Not that normal.
What?
It's the good one compared to my other one.
Yeah, you have a lot more motion in your other one. And then this way into inversion, she's at 0 to 28. Okay? And you can do that actively and passively. You want to have the ankle, if the person has plenty of motion, you want to keep them pretty close to 90 degrees because then you have a standardized position for her. Her resting position is so far out, even on her good leg, of neutral, that I'm going to let her just stay where she is because I'm going to limit her motion by pulling her into 0 degrees of dorsiflexion. Okay?
So,
All right.
is this just another way to do it, or is this the subtalar?
This is subtalar.
Okay.
So we had dorsi and plantar flexion with the knee bent. We had what maybe we should call is supination and pronation, which was the anterior approach, and we're getting all of those measurements. Then we have subtalar inversion and eversion. Okay? Why don't you go try those 6?